Okay, to continue our discussion, the second predisposing factor for your pulmonary embolism is your endothelial wall injury. With your endothelial wall injury, this is where we start having your clotting or your coagulation. Remember when we ever have your wounds, yung wounds na yan yung sinasabi nating injury, but this time around, it happens in the walls of your endothelium. With the injury that that has been subjected to your wall, okay, to your vessel wall, there is a possibility that the coagulation or the clotting would likely happen there, and that increases the chances of having your pulmonary embolism. Next, we have your stasis. With your stasis of your blood circulation, it also is a contributory factor for increasing your coagulation. Kasi kapag nakastuck yung dugo dyan, di ba naninigas yan? It actually becomes a little bit thickened, and eventually you end up having your clots. Okay, the creation of clot is likely to happen with your blood stasis. Okay, so these are your components for your Virchow's triad. Now, predisposing factors, as I mentioned, you have your blood stasis. Um, not much of your circulation is going on since blood is stuck in that specific area. You will have caused by maybe by prolonged immobilization. Then you will have your blood stasis causing you to have again creation of your blood clots. Concurrent phlebitis, from the term phlebitis, phleb means vessel, blood vessel. Itis means inflammation of. So this is the inflammation of your blood vessels. Specifically, if you have maybe your deep vein thrombosis, okay, remember your peripheral vascular disorders. Kapag meron kang deep vein thrombosis or mga DVT natin, there is the inflammatory reaction or the inflammatory response on your blood vessels, causing you to have your, well, in this case here, you have your phlebitis. Pwede din naman na nagkakaroon ka ng phlebitis because of an IV insertion that is made on a specific vein, tapos pumutok. Okay? Then you can have your phlebitis there. Heart failure and stroke. These particular disorders follow the principle of occlusion. And the occlusion there is actually caused by your blood clots. Whether it is going to be in your coronary artery, okay, as in the case of heart failure, or maybe even your stroke. Okay? Injury to your vessel well, it's a part of your Virchow's triad. I've already mentioned that one. Coagulation disorders or hypercoagulable state, yung mabilis na mag-clot na capability ng isang pasyente. Malignancy, cancer, yes, it has a predisposing effect on the patient actually experiencing your pulmonary embolism. Advancing age, your estrogen therapy, anything that has something to do with your hormones, really. With age, you have your hormone problems. With your estrogen therapy, you have your hormone problems. With the use of your oral contraceptives, you also have your hormone problems. So yes, hormonal imbalance, as it may see fit, is actually also one of the reasons why you have your incidence of your pulmonary embolism. Fracture of long bones. Why do we have your fracture of long bones there? Because with long bone fracture, you have high chances for clots to actually occur in your deep osseous tissues. Okay? And pag long bones ang pinag-uusapan natin, let's talk about your humerus, your femur, okay? When these are actually fractured, marami pong dugo ang lumalabas saan. And at the same time, in your body's attempt to restore your homeostasis, there's also a high percentage of coagulation to happen as a result of that long bone fracture. Because your bones are actually very vascular structures. Okay, so any break in that one will cause you to have your bleeding. And at the same time, kung gusto ng katawan mo na ma-recover yung normal state again, you will have your increased chances for your coagulation. Obesity, yes, also has something to do with your hormones. Ayan, hormones din siya. Pwede din siyang associated with your stroke, causing you to have your blood clots. Okay? So, all of these are predisposing factors for patients who are suffering from your pulmonary embolus. What are the anatomic alterations? Dahil meron kang blood clots dyan, yung magkakaroon ka ng obstruction on your vessel. The diameter of your vessel will actually be obstructed appropriately. If there is your pulmonary infarction, which definitely not only happens in your myocardial tissues, but yes, pwede pong pumutok doon sa ating pulmonary structures. Okay, you might have your infarction there. Alveolar atelectasis kapag nagkaroon ka ng rupture ng alveoli natin. Yan ang tinatawag nating alveolar atelectasis kasi hindi lang isang blob ang magpuputok saan, kundi pati yung adjacent na mga alveoli na malapit sa kanya, pwedeng pumutok dyan. Eventually, you lose your elasticity of your alveolar sacs. And at the same time, you end up having your collapse of that specific area of the lung. Alveolar, or maybe you will have your alveolar consolidation because there's just so much that is inside your alveoli. Okay? And eventually, you also have your bronchospasm because this is due to your inflammatory response. Um, Dapat walang bronchospasms dito kasi what is expected of your bronchial airways is to actually dilate so that you can have appropriate entry of your oxygen, correct? However, because there is anatomic alterations that are already happening, you end up even uh, having your bronchial airways affected. So bronchospasm is likely one of the manifestations also, or anatomic alterations that are expected of your pulmonary embolism. Paano mo malalaman na meron kang pulmonary embolism? Actually, mabilisan to eh. This is a very, very quick evaluation for patients who are suffering from pulmonary embolism. Sometimes many people are also misdiagnosed to having your pulmonary embolism. Bakit kamo? Because they don't mind, they think that it's just your normal respiratory distress, but in the diagnostic procedures, doon nila malalaman na, oh my God, there is your pulmonary embolism causing you to have your blockage here. Can you imagine that one? Yan no, ganyan kahaba. Okay, this is what is seen with your VQ scan. VQ scan is your ventilation perfusion. Ventilation perfusion scan. So for every time that you are going to have the entry of your oxygen or your gas, there is an expected ratio for perfusion. For 1 ml is, I think, is equals to, ay, nakalimutan ko na. Basta, it has a specific ratio for the blood that is flowing, a specific volume of blood equals to a specific volume of your air that is being perfused into your circulation. That is your ventilation perfusion scan. So if your imaging shows to you that there's enough ventilation but there's no proper perfusion, then something is wrong with your pathway towards your pulmonary lung fields. Okay? But the gold standard for the identification of why a person has or how a person has your pulmonary embolism is through your pulmonary angiography. Remember, ayun ang angiography. Kasi mismo sa vessels ang pinag-uusapan natin dito, hindi ba? Doon sa pulmonary vessel natin, nakita natin na meron kang blood clots na sobrang haba, sobrang laki, causing you to have your occlusion. Okay, your D-dimer assay, your ABG levels, and even your chest X-ray provides you supplemental information to confirm that indeed there is occlusion, there is blockage, and there's no proper perfusion that's happening there. Okay, but the gold standard for the identification of your pulmonary embolism will always be your pulmonary angiography. which again, I've mentioned, will have to use your contrast medium or your contrast dye. And you already know what to do when you have your administration of your contrast medium. Okay? Next, management. Yan. Kasi nga, meron kang occlusion. Malamang, hindi makakapasok yung hangin. So, therefore, since hindi makapasok yung oxygen natin, bibigyan mo kung ano ang wala, and that is your oxygen administration. You need to establish your IV access because you need to give medications to provide your bronchodilation. Okay? Or maybe to correct your problem in your blood pressure, such as you have your vasopressors and your inotropic agents. Once kasi a person suffers from your pulmonary embolus, you will have difficulty of breathing, you will have your labored respiration, and you are expected to have your your shock. Okay, your client has a possibility that he might go into shock because there's no proper perfusion nga, hindi ba? Okay, so hence you have your vasopressors to help you with that one. You also have your inotropic agents to help you with that one. ECG monitoring is very important here because you would like to find out if there is your involvement of your cardiovascular your system. Okay, small doses of morphine is also provided because your morphine is a vasodilator, which is very important kasi nga meron tayong occlusion dyan. And at the same time, it also decreases the chances for the client experiencing your anxiety. A client who has your pulmonary embolism has your labored breathing, right? Anything that has something to do with your labored breathing increases the likelihood of the patient experiencing your anxiety. We don't want an already, you know, already weak patient suffering more because of his anxiety that, okay, there is impending doom that's gonna happen to me. I have no control over what's gonna happen to me because I cannot breathe properly. Okay, hence you provide your morphine sulfate in small doses so that it has that, tranquilizing effect, sedative effect to your patient. If worst comes to worst, if all of these are not going to be effective, then you are going to prepare for your intubation and also your mechanical ventilation. Okay? Next, we have anong mga gamot na para sa mga pasyenteng mayroong pulmonary embolism? Your embolus is basically a detached clot, correct? So, clot. How do you resolve a clot? Remember, you have your anticoagulants. So, in order for us to stop the clot from actually becoming bigger and bigger, and maybe even detaching itself from your endothelial wall, what can you do? You provide your heparin, you provide your warfarin. Okay, whether it's going to be given as your intravenous or subcutaneous, your heparin and your warfarin are very effective medical management options for patients who have your pulmonary embolism. Thrombolytics, I have already mentioned this one also. Ayan yung mga streptokinase natin, lahat ng mga kinase, lahat ng mga ACE or your tissue plasminogen activators. All of these are very, very important to combat your clot formation from actually happening. I have already given you information on the different side effects as well as your interventions for patients who have your anticoagulants and even your thrombolytics. Okay? Surgical intervention. Kung hindi madaan sa gamot ang ating embolus, anong gagawin mo? Dapat nating tanggalin ang embolus. So, what are we going to do? You have your intraluminal filter insertion. Okay? And you also have meron kang i-insert na filter, like an umbrella, which tries to stop your clot from actually causing you further occlusion. So, yung filter na parang umbrella na yan yung parang magbe-breakdown doon sa ating, not breakdown, but technically not allow your clot, the huge clot, from actually passing through. Okay, so didikit siya doon sa ating umbrella filter. Well, eventually, because of that very high pressure in your blood, lumiliit siya. Okay, so you have your intraluminal filter insertion. There's a picture on this one. Later on, I will show to you. You also have your embolectomy, embolusectomy. What does it mean? It's the removal of your embolus. So it can be done through your open surgical embolectomy or through your catheter embolectomy with fragmentation. Wow, I have never seen these two from actually being done. However, I think in Norma Medical Center, they also have this particular, ano to, um, they have this particular procedure doon sa ating cardiac catheterization laboratory. So, lucky for Ilocanos then, they have that one. This is your intraluminal filter insertion. Ito yung sinasabi ko, parang umbrella. Actually, umbrella talaga siya. Ayan. Yan mga, para hindi makalusot yung ating hindi makalusot yung ating mga clots dyan. So, this is your inferior vena cava. This is a part of your portal, portal circulation. Portal circulation. Pati ito, kasama siya. It's your vein and even your artery. Okay, which is likely connected to your kidneys and at the same time doon sa ating liver. Okay? So, ito yung medyo mataas din na pressure aside from ating peripheral vascular pressure. So, this is your intraluminal filter insertion. Next, we have your open embolectomy. Ayan. Ito yung sinasabi ko na nakita ko doon sa YouTube. They have removed a very, very long, I don't know, 10 cc siguro yung 10, mga 10 ml kung ikopan mo siya, ilalagay mo siya ng volume. Sobrang haba na embolus, pulmonary embolus at that from a patient. Imagine niyo sobrang dami na mga vessels ang na-block because of the presence of that very, very long embolus. Sabi ko, you can actually die from this one because of shock and also from lack of perfusion, oxygenation at that. Okay, so these are your interventions for patients who have your pulmonary embolus. Okay, so that ends the first part of discussion of our lower respiratory tract infection. We will proceed with your COPD and then your tuberculosis later on. Thank you so much, guys.